Hey, this is Brandon with ChiroUp. I want to talk about two factors that I think are the most important factors when it comes to treating the shoulder. One is treating all facets of joint dysfunction. Obviously, as chiropractors, we're great at that. However, with the shoulder, it's a little bit specialized because the shoulder is not one of those joints that's amenable to a lot of manipulation. It already has too much mobility, but there is one loss of range of motion I think that is very important, and that's inferior glide. As it turns out that when you pick up your arm into abduction, after about 22 degrees of abduction, your glenohumeral joint is going to slide upward towards the acromion about 10 millimeters. That's not okay. And the reason it's not okay is because there's squishy stuff in the middle. That's your bursa and that's your supraspinatus. So when you go through Hawkins-Kennedy and you go through Neer's test, every single person impinges that space. The question is that tissue irritated? And if that tissue is irritated and has any kind of chemical inflammation or mechanical disruption to that tissue, it's going to hurt, and we call that impingement syndrome. The problem is that loss of inferior glide is going to create constant reoccurring impingement of that area, and that leads to other issues like a failed healing response within the rotator cuff or any kind of degeneration, tears, or what have you. So that's something that we need to be able to address. So creating inferior glide, I've attached a video of me treating that with a participant in a past seminar. The second part is, why is that patient going through too much superior glide of the humerus? And that's normally due to a failed response of the rotator cuff. The rotator cuff is tasked with not only providing movement to the shoulder, but also holding down the humeral head and making sure we don't go through superior translation. If the rotator cuff isn't strong enough or has any kind of disruption within the tissue, then it's not going to be able to perform that task. So we'll start to see weakness in the rotator cuff causing more impingement. So it begs the question, is the rotator cuff syndrome actually before impingement syndrome or is it after? I don't know if we quite know the answer, but what I can tell you is if you're treating rotator cuff syndrome or if you're treating impingement syndrome, you better be strengthening the rotator cuff regardless of the diagnosis because of that excess superior shear. So what we do in our practice is we absolutely go through our orthopedic diagnosis and come up with a proper tissue injury, whether it's impingement syndrome or a slap lesion or biceps tendinopathy or rotator cuff syndrome. But regardless of whatever tissue is injured, we know we have to correct those two factors. We need to correct the proper mechanics of the joint, restoring inferior glide, and we also have to make sure that the rotator cuff has adequate stability and capacity to perform its task. So that's what we're going to do as far as the rehab. I've attached a PDF with our rehab exercise that we use in our practice, and of course in this blog I have a video also of me performing inferior glide on a patient, along with also I think improving a little bit of internal rotation. Utilize these methods in practice. Start utilizing these exercises as far as patients on Monday, and I hope to get better results in my practice, and I'm sure you're looking to always get better results in your practice. Thanks a lot. Check out the other parts of the blog. We talk about inferior glide a couple times throughout the last couple of years in the blog, and we also talk about different types of diagnoses within the shoulder, especially when you dive into the functional realm as far as scapular dyskinesis. If you have any questions on any of those things, search within the blog for those keywords, and hopefully you can pick up some more information, more tidbits or tips that can help you get patients in and out of pain as fast as possible. Also, very excited for version 2 coming out. You're going to start to see more emails on that. The emails will take you through as far as quick video tutorials on what version 2 is, and also give you some snapshots of how cool it's going to be. I think it's going to be a game changer as far as the chiropractic profession.